In the Know, where we interview and have discussions with informed people so that you too can be in the know. We brought Dr. Vipul Desai back from the Houston Center for Infectious Diseases to help us better understand what protocols and procedures we should be following in these scary times. Dr. Desai, welcome back.
Thank you for having me again.
Well,
Thank you.
so glad that you're making the time. You know, it seems like this is something you've been doing all of your life, being in the infectious disease business. I mean, you've had to be concerned about everything that goes on at your office, and then you're going home. You have a family. You've got a lovely wife. You have children. I mean, these are. So tell us, if you will, in a nutshell. I mean, these things that we're being asked to do now are things you've been doing always.
You're right, Hank. As an infectious disease specialist, we've been trained, and during our training, as well as just the things we see on a day-to-day basis, we deal with different types of bacteria, viruses, funguses, and the certain ones we have to be careful and be not have contact isolation. Other ones we have to protect ourselves from respiratory, like the coronavirus. We want to maintain a distance of at least like 6 feet.
Are we okay here?
And we do want to maintain proper, as we discussed in the previous episode, about proper hand washing, 2 minutes or so, if you're able to, not to touch your face. Social distancing would be good in crowded environments like that, and that goes for a lot of the respiratory illnesses, just not the coronavirus, but also like the flu, rhinoviruses, and things like that.
So what happens, for example, you're at a movie theater and the person behind you starts coughing. It would seem to me that most anyone, if we're even going to the movie theater, we're not going to movie theaters right now, I understand, but if we're going to, we would get up and leave, correct?
Correct.
But we should have been doing that in the past also. I mean, if there's this cough that's spewing the virus, the infection, whatever it is, I mean, that's just as, we've lost, 50,000 people a year to the regular flu in the United States? I mean.
Correct, yeah, we have about 500,000 or so hospitalizations due to flu. We have about 50,000 in this country alone that die of the flu.
And that's not that's not elderly people only, that's all ages.
All ages, absolutely right. And in situations like that, you'd hope that person is covering their cough, and when we mean by covering, we're not talking about your hands or anything like that. We want them to use their elbows and turn around and cough or sneeze into their elbow like that. And possibly be able to do like a little bit distancing as well too.
So how do we get people to actually practice that? I mean, I know that in the past, I'm speaking in the past, not today, people that are sneezing or sort of sniffy, whatever, that show up to work or show up to a meeting, or in my business show up to see a house, and they're sort of, and they go, oh, it's the allergies. And it's clearly not the allergies. And there's been times where I later have ended up sick. So you have to do it at your office. So teach us people, what is the professional way that we can go, stop?
Yeah, we kindly ask them to cover up their cough or their sneeze, and feel free to do a fist pump or an elbow bump like that as well if you feel need to. I always carry like a hand sanitizer or something like that. So
do you offer it to the other people?
I will.
Okay.
I will.
Okay.
And then I'm kind of mindful, and it takes some time getting used to, is to not to touch your face. And this goes for around this time for coronavirus as well, but also for the flu and other respiratory illnesses. You do want to be careful about touching your face, especially if you've touched other surfaces and someone who may be carrying the virus. So use a Purell and then scratch your nose or touch your face. Yeah.
So how long does this thing stay alive? We've been hearing that it stays on stainless steel, can live for 3 days, or on the cardboard box that comes in from Amazon, that it can be alive for hours. Can you give us the data as you understand it? You'll know a little bit more about it than we will.
Yeah, there's still research being done on this particular virus, but generally speaking, different surfaces, the virus can stay alive from a few hours to maybe even a few days, possibly even 7 to 9 days even, depending on the environment of the room temperature, how dry it is, things like that. Steel and cardboard, porous versus non-porous, it stays various ways depending on what surface you're dealing with. And that happens even during other times when we don't have a pandemic going on, when we have the regular flu season or something like that going on. The same thing I encourage everyone to do, which is don't live in fear, but make it a habit to, as you're out and about, be mindful to things about door handles, airports especially, cruises where there's a lot of congregation, a lot of people there. You want to be mindful of and just imagine as someone is entering in a cruise on a doorway, how much touches that the doorknob is getting. Mm-hmm. And from that point on, how long, even if the virus was staying there for 30 minutes or an hour, 2 hours, and then if you touch that, now you've scratched your nose, you are going to get sick. So this is what I've encouraged my patients, and one of the things that we do at the Houston Center for Infectious Disease is that we do travel medicine, and so from there we have clients that are traveling all over the world, and then not only do we do preemptive vaccinations or pills for malaria or even yellow fever and things like that, is that we also do teachings in our practice about the same thing at the airports. Wash your hands, don't touch your face, keep your distance, cover your cough, be careful in being in very tightly packed areas where you're mindful of anyone who may be sick or coughing.
And you know which countries are, certain things are prevalent, so as a traveler would come to you, they'd say, I'm getting ready to travel to East Africa, I'm getting ready to travel to the Middle East, or I'm getting ready to travel to the Orient. You'd be able to, you would guide them through what type of preemptive measures you'd want to take, and then also the other practices that they would have to follow.
Absolutely right. We do follow the CDC guidelines, and we see which country that they're going to, see if they're going to be risk for malaria, typhoid, if they're going to be risk for other types of illnesses that we can give them vaccinations for. Speaking of vaccinations, I do want to encourage everyone every year to get the flu vaccine, because that has shown to decrease flu, obviously, and to pass it on as well too. So I encourage to get vaccinations, flu vaccine every year, and when you're over age 65 to get the pneumonia vaccine as well.
Oh boy, I haven't had my pneumonia vaccine. So on food, I assume that also you're able to give guidance on what people should or shouldn't be, I don't mean literally eating, and you're not giving their dietary, but there's dangerous practices or lack of proper hygiene practices in many countries that have related to food, correct?
Absolutely right.
Which is where these diseases came from.
Absolutely right, Hank. So when our patients travel, we educate them about, and we spoke about the vaccinations and anti-malaria medications, but I also tell them about water. Water can get you in trouble into these countries, so I encourage my patients to have bottled water with them.
Or drink wine and beer, right? We've heard that, where you travel and you don't drink the water, you drink the beer, there's a good excuse for drinking more wine and beer, but anyhow.
Correct, and even if you have to use a bottle of water while you're brushing your teeth, that's perfectly okay. So feel free to have a bottled water there and drink from the bottled water. As far as food is concerned, I try to tell them not to stay away from cold food, salads and things like that. Warm, hot, freshly cooked food from the restaurants is more safer than eating on the streets or eating salad or something like that.
Okay. Well, that does make sense though, because we even have the scares here, with the lettuce and whatever it may be,
Correct.
that just wasn't washed properly. I
Correct.
guess.
From E. coli, salmonella to different types of infections you can get from things like that.
Dr. Sy, tell me one other thing. I know that at your practice you also you work with refreshing systems. I'm using the wrong term. Infusions, and tell us a little bit about that. And part of the reason that I want you to talk about it is, everybody, your general practitioner is who you see, and when they exhaust all avenues and then they need to go to specialists, sometimes finding the specialist in advance can save you oodles of money and time and health. And that's why it's important as we listen to Dr. Desai and what they do at their practice. But anyhow, tell us about that too.
Yeah, one of the things that we do at the Houston Center for Infectious Diseases is that's all we do is infectious diseases.
Correct.
So that being said, we focus on infections, all types. We focus on recurrent infections. One of the things that we offer in this community and what we have is wound care as well as infusions. When I mean infusions, I'm talking about IV antibiotics, similar antibiotics that you would get at the hospital. So what we're trying to actually really do in helping the community is that we're trying to decrease the admissions to the hospital, readmissions to the hospital, because if they're needing to go into the hospital to get an IV medication, they're taking up resources, they're taking up beds, they're taking up, and then there's cost issue involved as well. We can treat the same infection by giving them the same medication in our office, then we've kept them at home, we kept them with their family, their loved ones,
Mm-hmm.
we kept them out of the hospitals, and we've got them better in that regards.
Excellent. And that's right here in the Woodlands.
Right in the Woodlands, and
Yeah.
we educate, we test for immunity as well, we check your immune system. If we need to do anything with that, we have options available as well. But yeah, we have many options, from travel medicine to HIV medications to hepatitis C to resistant organisms, very resistant organisms that are difficult to deal with, especially in the community. If you have I'll give you an example, like a urinary tract infection.
Okay.
Patients go to the primary care doctor, and they're treated well. They're given the right medication, but after a while, the bacteria will find a way to become resistant. And so now the primary care physicians or the urgent care centers are having a difficult time of treating that, because the bacteria has found a way to become resistant.
And that's not their bailiwick either. That's not their specialty.
Exactly.
Okay.
So now they either go to the hospital to receive this medication,
Mm-hmm.
or they can come to us, or we can give a medication and get them better that way.
Well, it sounds like it's a service that is extremely important. We don't want you to have to go see Dr. Desai and his group because we don't want you to have anything wrong. But we all know that we catch something, and there's certain things that we're in need of, and so right here in the Woodlands, we have a very well positioned business and a practice that can take very good care of you. Thank you again for coming on and sharing some information with us, and once again, you all are in the know.